Begin with Carlos Cossio, Emergency Manager for the Community Clinic Association of Los Angeles County. Carlos?
Basically, we work with community health centers in all over LA County. We provide advocacy, we provide policy guidance, training. We're sort of a hub and spoke of information. And really, as that relates to emergency management, my role is to turn around and take that part of the HPP Hospital Preparedness Program money and work with the clinics to develop plans and policies, training around disaster preparedness. And so we work through a number of different means, if it's planning, if it's communications, which we'll be talking about today, training and exercises, and also engaging them in a way that connects to their local partners through what's called disaster resource centers, sort of these hospitals that have been, these acute care hospitals that have been sort of vested with this responsibility of local planning and sort of being the shepherds of very specialized equipment and surge capacities. So essentially we're sort of this hub and spoke of bringing the clinics in and then pivoting to expose them to sort of that larger disaster preparedness community. I mean, we're not in the business of making apps or really in the technology business, but really we had this sort of idea of giving the clinics some meaningful way of enhancing their sort of response capabilities. Clinics, as you can imagine, everyone wears multiple hats. No one's really an emergency management expert. Hospitals tend to, not always, but especially the disaster resource centers tend to have a lot more resources that they can bring to bear. And so really our role is, what can we give the clinics that would obviously be meaningful from a disaster response perspective, but that could also be integrated into their sort of daily workflow, something that makes sense for them, something that's easily adoptable and adaptable. So in sort of our preliminary sort of scheming of what this would look like, obviously I mentioned scalability, not only in the sort of broader healthcare community, but also within clinic organizations, many of which, when you think of a community health center, you may think of maybe just sort of one standalone facility. But the reality is, many of our organizations are fairly large, employing hundreds, upwards of 1,000 employees, and have multiple sites scattered around LA County. So we want something that can be really integrated, that can be really adopted within a facility, and also something that's used across and within an organization. Reliability, if this looks familiar, these sort of terms, it's really just sort of a NIMS way of thinking about communications and information management. We want communication systems that are all these things. And obviously redundancy, and that's kind of where I think on the next slide we'll be looking at that. So essentially we brought on SpotOnResponse. So we had a few conversations early on, and we described to Jim what we were looking for. Really something that, and obviously there's been a lot of iterations of this project, but what we were looking for was some way for clinics to get a handle of what's going on locally and what information can I share with my response partners. The information that my stakeholders input is very much what they are experiencing, what their needs are, if they are submitting a resource request, things like that. And we've recently introduced what's called the status update. And so what SpotOnResponse brought in for us, in addition to sort of this non-healthcare sort of situational awareness, and that was really one of the interesting features, was there's a broader community outside of healthcare potentially contributing to this system, and that information that clinics could really use and leverage to make informed decisions. And so that was really part of the added value, as well as giving the clinics an opportunity to sort of organize or present or display what are their services. So if part of the idea of this planning, and part of the idea of how do we build those meaningful relationships across our healthcare partnerships is, do they understand what resources clinics are able to bring to bear if they're needed? So part of what we established were these clinic profiles. And so these profiles are able to give the user a sense of this particular organization can offer these services, these are their working hours and things like that. Sort of administrative, but really helpful and probably fairly important in the long run, especially when you're looking for services under conditions of duress. In terms of redundancy, Jim was able to build out, and part of our main project scope was this mobile application, but then also having this web application, this sort of web interface and website that they were able to tap into. Obviously, if we want to be mobile to the extent that we can or the extent that we need to, but obviously there's circumstances where we're just sitting at our desks, and then also having this capacity for this sort of offline access to things like floor plans and emergency plans. So clinics are able to upload these documents, these organization-specific documents that, more and more they're not physical documents necessarily. They're maybe on some internal drive. They may be on the on their desktops, things like that. But then when those systems are compromised, we want to make sure that they have access to the most recently saved documents. So that was part of it. And then the operating status, giving clinics that option of being able to update their what is going on, letting the broader community know of what their status is, and giving me from an association perspective, are my clinics open? Do they have some sort of special condition that I need to be probing and asking them, do you need my support? What can I do to kind of keep you open and make sure you're up and running? Or are they just closed? And so then we can look forward in terms of resource management and providing that sort of common operating picture for the county in general. So that's kind of what we're looking at moving forward.